Many things affect your health: genetics, lifestyle, modern medicine, the environment in which you live and work. But although we rarely consider it, the degree of competition amongst healthcare organizations also impacts your health. That's the topic of this week's Healthcare Triage. Special thanks to Austin Frack, from whose Upshot column this episode was adapted. Markets for both hospitals and physicians have become more concentrated in recent years. Although higher prices are the consequences most often discussed, such consolidation can also result in worse healthcare. Studies show that rates of mortality and of major health setbacks grow when competition falls. This runs counter to claims some in the healthcare industry have made in favor of mergers. By harnessing economies of scale and scope, they've argued, larger organizations can offer better care at lower costs. In one recent example, two Texas health systems, Baylor Scott & White Memorial Hermann Health System, sought to merge, forming a 68-hospital system. The systems have since abandoned the plan, but not before Jim Hinton, Baylor Scott & White's chief executive, told the Wall Street Journal that, and I'm quoting, "The end, the more important end, is to improve care." Yet Martin Gaynor, a Carnegie Mellon University economist who is an author of several reviews exploring the consequences of hospital consolidation, also said that, and I'm quoting, "Evidence from 3 decades of hospital mergers does not support the claim that consolidation improves quality. This is especially true when government constrains prices, as is the case for Medicare in the United States and Britain's National Health Service. When the government sets prices, hospitals don't compete on price. They compete on other stuff, like quality. But this doesn't happen in markets that are highly consolidated." In 2006, the National Health Service introduced a policy that increased competition among hospitals. When recommending hospital care, it required general practitioners to provide patients with 5 options, as well as quality data for each. Because hospital payments are fixed by the government, whichever hospital a patient chooses gets the payment for care provided to that patient, hospitals ended up competing on quality. One study shows the consequences of this policy included shorter hospital stays and lower mortality. For every decrease of 10 percentage points in hospital market concentration, 30-day mortality for heart attacks fell nearly 3%. Another study found that hospital competition in the NHS decreased heart attack mortality, and several studies of Medicare also found that hospital competition results in lower rates of mortality from heart attacks and pneumonia. Another piece of evidence in the competition quality connection comes from other types of healthcare providers, including doctors. Recently, investigators from the Federal Trade Commission examined what happens when cardiologists team up into larger groups. The study, published in Health Services Research, focused on the healthcare outcomes of about 2 million Medicare beneficiaries who had been treated for hypertension, for a cardiac ailment, or for a heart attack from 2005 to 2012. The study found that when cardiology markets are more concentrated, these kinds of patients are more likely to have heart attacks, visit the emergency department, be readmitted to the hospital, or die. These effects of market concentration are large. To illustrate, consider a cardiology market with 5 practices in which one becomes more dominant, going from just below a 40% market share to a 60% market share, with the rest of the market split equally among the 4 other practices. The study found that the chance of having a heart attack would go up 5 to 7% as the largest cardiology practice became more dominant. The chance of visiting the emergency department, being readmitted to the hospital, or dying would go up similarly. The study also found that greater market concentration led to higher spending. And a different study of family doctors in England found that quality and patient satisfaction increased with competition. For many goods and services, Americans are comfortable with the idea that competition leads to lower prices and better quality. But we often think of healthcare as different, that it somehow shouldn't be market-based. What the research shows, though, is that there are lots of ways markets can function, with more or less government involvement. Even when the government is highly involved, as is the case with the British National Health Service or American Medicare, competition is a valuable tool that can drive healthcare towards greater value. Hey, do you like the show? It really helps if you subscribe or like it wherever it is on the screen right now. And another good way to support the show is at patreon.com. Go to patreon.com/healthcaretriage. We'd especially like to thank our research associate Joe Sevitz and our Surgeon Admiral Sam. And if you want more content, go to our podcast. It's great. The Healthcare Triage Podcast, wherever you download podcasts or wherever they're available. And of course, my book, The Bad Food Bible, still on sale in stores. Appreciate it if you pick up a copy.